clinical chemist is a laboratory specialist who works in a hospital. The main task of a clinical chemist is to analyze blood and other bodily fluids on behalf of medical specialists. Before a doctor can determine a treatment method, it is important that the doctor knows exactly which disease he or she is dealing with. It is the clinical chemist who will examine the blood or other body fluids on behalf of the doctor, so that the doctor in question can eventually draw up a treatment plan. A clinical chemist can examine blood, urine, and spinal fluid in a laboratory through the use of various instruments and devices. In general, a clinical chemist will not carry out the research himself, because there are other laboratory staff for this. A clinical chemist can be the person ultimately responsible for a hospital laboratory, but this does not always have to be the case, because there can also be several clinical chemists within a laboratory. A clinical chemist may also be the leader of certain research areas within the laboratory. A clinical chemist who works as head of a laboratory can also be seen as a manager. In that case, the clinical chemist is also responsible for all additional administrative and financial tasks related to the laboratory. The work of a clinical chemist can be regarded as important and specialist work, which should be left to the right specialists. The profession of clinical chemist is a profession at university level. A clinical chemist is employed within medicine and the natural sciences, which in this case usually involves practical research work. In addition, a clinical chemist may be responsible for conducting scientific research.